Hey everyone, ready for another deep dive? This time, we're heading to East Baltimore
Yeah.
to explore this fascinating research paper from 2005
Uh-huh.
that examines the connection between urban redevelopment and the health of the community.
Right.
And we're talking about a community facing some serious health challenges back in 1999.
Oh, yeah, some really stark statistics.
Yeah, like significantly higher rates of HIV/AIDS,
Homicide,
AIDS,
infant mortality,
mental health issues, the whole gamut.
way higher than the rest of Baltimore City and even Baltimore County.
It's pretty alarming when you look at the numbers.
It is.
But thankfully, this research goes beyond just the statistics
Absolutely.
and uses census reports, health department records,
Yep.
and most importantly, powerful firsthand accounts from residents.
Right. From the people who lived it.
Exactly. So we get to hear directly from the community about how this redevelopment impacted their lives.
And that's where the concept of social capital comes in.
Okay, social capital. Now that sounds a little jargony.
Yeah, it can be.
Can you break that down for us?
Sure. Think of social capital as the glue that holds a community together.
The glue.
Yeah, it's all about the relationships,
Okay.
the connections people have with each other,
Right.
and with the institutions that shape their lives, like the government or big employers.
So in a healthy community,
Yeah.
there's a lot of this glue.
Right. The researchers talk about two types of social capital.
Two types.
Yeah, one is communitarian,
Communitarian.
which is all about the connections within the community itself. You know, the trust, the shared experiences.
Gotcha. So people looking out for each other, working
Yeah,
together.
exactly. And then there's institutional social capital.
Okay, so that's the second type.
Right. That's about the bridges between the community and those big players I mentioned.
Mm.
Like in East Baltimore, a major player is Johns Hopkins.
Ah, Johns Hopkins, the renowned hospital and research institution.
Uh-huh.
So institutional social capital is about how well the community can connect with and influence those institutions.
Exactly. It's about having a voice, being heard.
So ideally, you want both types of social capital to be strong.
Absolutely. That's what makes a community resilient.
Makes sense.
But what the researchers found in East Baltimore was that both types of social capital were really strained.
Strained. How so?
Well, on the communitarian side, there was a ton of fragmentation.
Fragmentation.
Yeah, get this. There were over 900 community organizations
900.
for a population under 90,000.
Wow. That's a lot of organizations. You'd think that would be a good thing.
You would, right?
More organizations, more support, more people working together.
But in this case,
Yeah.
it actually had the opposite effect.
How so?
Instead of unity, it created competition. Organizations were constantly vying for resources,
And the force.
funding, recognition, you name it. It bred distrust.
So instead of coming together,
Yeah,
the community was kind of pulling itself apart.
exactly. Bonding within the community fractured.
And that's just the communitarian side.
Right.
What about the institutional side?
Well, that's where Johns Hopkins comes in.
Right, Johns Hopkins, a huge presence in East Baltimore.
A major employer, a big economic engine for the area.
And did that create strong institutional social capital?
Well, that's where things get complicated.
Complicated. How so?
The researchers call it a dual role, anchor and antagonist.
Anchor and antagonist? Now, that's an interesting way to put it. So Johns Hopkins is holding things down,
Uh-huh.
but also causing friction.
Yeah, you could say that. On one hand, Johns Hopkins provides jobs, brings in revenue.
On the other hand,
There's a long history of displacement associated with the institution,
displacement.
like people being forced to move out of their homes to make way for new development.
And did residents feel like they had a say in these decisions?
That's the thing, they didn't. Many residents felt like they were being pushed aside,
Pushed aside.
ignored, even exploited.
Exploited. In what way?
Some residents felt like they were being used for research purposes.
Without their full consent or understanding.
Exactly. And that created a lot of resentment and distrust.
So even though Johns Hopkins was contributing to the economy,
Yeah,
it was also creating these social and emotional rifts within the community.
absolutely. It's like this
A
paradox.
paradox.
Yeah, Johns Hopkins pumps billions into the Maryland economy.
Uh-huh.
But some residents describe its presence as a plantation.
Wow. A plantation.
Oh,
That's a really powerful image.
it is. And it speaks to the deep disconnect between the institution's goals and the lived experiences of the community.
Right. The institution is thriving, but the people are struggling.
And feeling powerless.
Powerless to shape their own neighborhood.
Exactly.
So we're seeing this breakdown on both sides of the social capital equation.
Right.
And it's all happening against the backdrop of this major health crisis.
Uh-huh.
How did the researchers connect these dots?
Well, they argue that this erosion of social capital, both communitarian and institutional,
Yeah.
directly impacts residents' health.
In what way?
Think about it. Imagine the stress and anxiety of feeling like you have no control over your own neighborhood,
Yeah.
your own future.
Like the rug is constantly being pulled out from under you.
Exactly. And that takes a toll, especially in a community already facing so many challenges.
Right. It's like adding insult to injury.
Absolutely. And we see this play out in the firsthand accounts from residents.
Oh, really? Tell me more about that.
Well, one resident, Mr. Bernard,
Mr. Bernard.
talks about his health deteriorating after receiving a relocation notice.
A relocation notice?
Yeah, he was being forced to move.
And how did that affect his health?
His blood sugar and blood pressure skyrocketed.
Wow.
And he just felt completely drained physically and emotionally.
That's heartbreaking. You know, it's one thing to talk about statistics,
Yeah.
but to hear someone's personal story like that,
It really brings it home.
it does. It makes it real.
And Mr. Bernard's story isn't unique.
There are others.
Yeah. Another resident, a 72-year-old woman named Mrs. Brown,
Mrs. Brown.
talks about the prevalence of illness in the neighborhood.
And what does she say?
She expressed this deep frustration that Johns Hopkins, with all its medical resources,
Wasn't doing more to address their needs.
wow, she felt abandoned by this institution that's supposed to be dedicated to health.
Yeah. And she even said, they go to all places in the world to help people, but they don't even help us.
Oh, wow.
They just want us out of here.
They just want us out of here. That's a gut punch.
It is.
It really highlights the power imbalance at play here.
Right.
A powerful institution, a seemingly complicit government,
Uh-huh.
and a community struggling to be heard.
It's a classic case, unfortunately.
And the researchers argue that social capital alone doesn't fully explain the situation.
Right.
There's more to it than just a lack of connections.
Exactly. We also need to factor in the historical power dynamics.
Historical power dynamics.
Yeah, the racial inequalities, the economic disparities.
All the systemic issues that make this community incredibly vulnerable.
You got it.
Mm-hmm.
It's not just about a lack of connections. It's about who holds the power in those connections.
Who has the voice? Who gets to make the decisions? Exactly. And understanding that power dynamic is key to understanding the health consequences of redevelopment in East Baltimore.
So it's not just about rebuilding those connections.
Yeah.
It's about shifting the power,
Uh-huh.
making sure the community has a genuine say in shaping its own future.
Absolutely.
And that's a whole other layer of complexity that we need to unpack.
Me too.
But we'll save that for the next part of our deep dive.
Sounds good.
So it seems like redevelopment can be this double-edged sword, right? You have the potential for improvement.
Uh-huh.
But when there's this lack of social capital, this power imbalance like we were talking about,
Yeah.
well, it seems like those negative consequences, especially for the residents' health,
Right.
they can be really severe.
You hit it right on the head.
Yeah.
Redevelopment doesn't just happen in a vacuum.
No.
It's all shaped by history, economics, and those power dynamics that we just talked about.
Right. And when residents don't have the power to shape what's happening, to speak up for their needs and be heard, that's when things can actually get worse. The inequalities get worse.
Absolutely.
And the health consequences.
Just get worse too.
Like a vicious cycle.
Yeah.
The displacement, the stress, the loss of support.
And it can trigger new health problems or make existing ones much worse.
So it's more than just losing your home. It's losing a whole way of life, a sense of belonging. And that can really impact your well-being.
It disrupts everything. Think about it. All those social connections for childcare, borrowing things, just for support.
Right.
And when that's all disrupted, it affects everything, even their health.
It makes me think about that quote from Mrs. Brown, the 72-year-old resident.
Yeah, what about it?
She talked about how Johns Hopkins helps people all over the world, but seems to ignore the needs in their own backyard.
And it's like they're disconnected.
Yeah.
A lot of residents feel disillusioned. Here's this institution with all these resources committed to improving health,
Right.
but the benefits aren't reaching them.
Right. So how can we even think about redevelopment in a way that really helps the community?
It's complicated, but this research gives us some clues.
What do you mean?
It comes back to social capital, both communitarian and institutional.
And how to make them stronger.
Exactly.
So how do we fix those broken bonds in the community to create that sense of unity again?
It starts by creating real connections and building trust.
But how do you do that?
It's more than just events or committees.
So what is it then?
Creating spaces where residents feel heard.
Heard.
Yeah, where their opinions matter, where they can come together to figure out their needs.
Working together to solve their own problem.
Exactly. It's about shifting that power dynamic.
Giving residents a real voice.
Right, a real seat at the table when decisions are being made.
I like that. And what about the institutional side of things? That gap between the community and the institutions.
Transparency and accountability are key.
So Johns Hopkins needs to be more open about what they're doing.
And the city government, too. They need to be clear about their plans and how those plans will impact the community.
And they need to follow through on their promises.
Exactly. And there needs to be a way for residents to speak up and have their concerns taken seriously.
It sounds like a whole new way of thinking about redevelopment.
It is. It's not just about buildings, it's about trust.
Collaboration, making sure the benefits are shared fairly.
That's it. Redevelopment is a social thing, not just economic.
And the community's health has to be a priority.
Right from the start.
It's a big challenge.
It is.
But at least we're starting to understand what it takes to get it right.
What do you mean?
Strong community ties, real partnerships with institutions,
Right.
and a focus on the well-being of the people who call East Baltimore home.
And we can't forget to listen to their stories.
Like Mr. Bernard and Mrs. Brown?
Yeah, they remind us that this is about real people's lives.
You know, this research really brings out the human impact of all of this.
Yeah.
We hear all these economic arguments all the time, all the promises about revitalizing things. But it's easy to forget about the people.
The people who actually live there.
Their anxieties, their hopes, their health.
All tied to these decisions being made.
It's not just physical health either.
No, it's mental and emotional, too.
That sense of belonging, that stability.
It's so important.
And when that gets shaken up by being displaced,
right.
by the fear of losing your home, your community,
it creates this chronic stress.
It can really have long-term effects.
Yeah.
I was looking at some old community photos of East Baltimore the other day.
Oh, wow.
Full of life. Everyone's laughing.
Yeah.
And you can't help but wonder what happened to those connections, to those support systems.
Right. How do you rebuild that sense of community?
Especially with all this redevelopment going on.
It's a tough question.
It is.
But other cities have found ways to give residents more control over their neighborhoods.
Like what?
Well, one idea that's been gaining traction is community land trusts.
Community land trusts. Yeah, I've heard of those. But I'm not really sure how they work.
So basically, it's a nonprofit organization.
Okay.
They acquire land and then lease it out.
Lease it out for what?
Affordable housing or other community-serving things.
Okay.
But the key is the land itself is held in trust.
So it's not part of the market?
No, it's protected from those skyrocketing property values.
The ones that often lead to displacement.
Exactly.
So it's like a safety net.
Yeah, and it goes beyond just keeping things affordable.
Oh, how so?
Community land trusts can give residents a voice in how things develop.
Like what kind of voice?
They can help set the lease terms, manage the properties, and make sure any new development fits the community's vision.
Wow, so they have real decision-making power.
Yeah, it flips the script.
Gives the power back to the people.
That's the idea.
Are there any other examples of this kind of community-driven approach?
Yeah, participatory budgeting is another one that's becoming popular.
Participatory budgeting? What's that?
It's where residents get to decide how public funds are spent on projects in their neighborhoods.
So they get to choose what gets funded.
Exactly. It's not just token involvement, it's real decision-making power.
That sounds amazing.
It does.
But have any of these ideas been tried in East Baltimore?
Well, those specific strategies weren't really around when this research was done.
Oh, right.
But the principles behind them,
yeah,
transparency, accountability, and giving the community real control.
Those were all things the researchers emphasized.
Exactly.
So this research isn't just about the past.
No.
It's about how to build a better future.
A more equitable one.
We started with these alarming health statistics. Then we dove into this whole world of social capital.
Right.
And now we're talking about these hopeful, innovative strategies.
And the most inspiring thing is that these changes often start within the communities themselves.
So it's about listening to the people.
Exactly. Sharing their stories.
Like Mr. Bernard and Mrs. Brown.
Yeah, using those stories to demand better.
To fight for redevelopment that actually helps people.
Right.
And it reminds us that behind all these numbers and policies, there are real people whose lives are affected.
It's about making choices that benefit everyone.
So as we wrap up this deep dive, I have a question for you, our listeners.
What's that?
Given everything we've explored, what would truly community-driven redevelopment look like in East Baltimore?
That's a good question.
What steps could residents, institutions and policymakers take to make that happen.
It's a conversation we need to have, not just in East Baltimore.
But everywhere.
Yeah, in every community facing these challenges.
Because ultimately it's about creating a future where everyone has the opportunity to thrive.
That's what it's all about.
Thank you for joining us on this deep dive. Keep those wheels turning and we'll catch you next time.